Our next speaker, Maddie Whalen, who is our expert in evidence-based practice. So Maddie, I'll let you take it from here.
Hi, everybody. I'm Maddie. I always tell people that when they make a PowerPoint, they should be able to do it even if the equipment fail. And I have unfortunately just tested myself on this. So we're going to start with a PowerPoint. We're still having someone come from IT to try and make the actual display work for you. But before we get started, so I'm going to be talking about whether or not you should really be doing an evidence-based practice project. So I'm the EBP coordinator. I'm an editor and author on the book, and I am one of the first people that will tell you that you don't necessarily need to do an EBP project. So just take a second. Is there anything that you've been thinking about that you think might be a good, like you have a curiosity or you have you've had a thought about something that's happening in your clinical environment that you think might be a good EBP project? Has anyone had one of those recently? Does anyone want to share what they have been thinking? I see nods.
Is this just a brewing thought?
Yeah, like a curiosity that you have just in the back of your mind.
I do. I would love to see looking at telemedicine and wound care. If what nurses select by looking at photographs, if that correlates to what you, excuse me, do with the bedside consult from the WCNs.
Okay, so you're saying that looking at pictures of wounds and what that correlates to with the bedside consult.
Yeah, if there's a strong correlation that your practice could be based on the photo and chart review alone, and how important is the bedside review?
Okay, so like, could you just do the job from the photo? Do you have to show up at bedside? That's very interesting. Does anyone else have anything? Yeah.
Just thinking about if like a communal space for like some of our geriatric population, just having that space to keep them engaged, whether it's like an activity room or somewhere that they can just like eat together with other patients and things, if that would be helpful for like delirium prevention or kind of keeping them de-escalated. So with like workplace violence, a lot of them are our patients are demented and delirious and things.
So sort of what evidence exists about putting older patients in a communal space to keep them happy and healthy? Okay, so before, one of the things I've been thinking about recently actually is has anyone ever heard that you shouldn't administer 2 antibiotics at the same time? Has everyone heard that? I'm an adult ER nurse. I've always been told that. Is there any evidence behind that? I'm curious. This might be like my new pet EBP project. Okay, so before we get into what EBP is and what QI is and what research are, I just wanted to talk really quick about definitions. So when we're thinking about evidence-based practice, we're thinking about what information already exists in the world. We're looking at existing publications, case reports, expert opinions to determine what is the best practice based on the literature as well as our own experience. So that's evidence-based practice. What do we already know? The other side of that coin is quality improvement. So we know what exists, we know what works, and we need to make sure we're making it work for our population, for our group. So many times what an evidence-based practice project will do is sort of push you into that quality improvement realm because you know that you figured out what that best practice is, you're trying to improve the practice or the process, and that's what gets you to your quality improvement methodology. So there's a lot of sort of ebb and flow between the two. But if you think about EBP is what we know, and QI is we know what we know, now what do we do with it? And those are the 2 of the 3 legs of the stool for EBP QI, and then that third leg is research, which we're not going to talk about as much today. But if we think about sort of a jumping off point, so EBP is where we start. We need to see what sort of the lay of the land is with a lot of this information, and then we can dive into quality improvement methodologies or research methodologies, depending on whether or not we have enough information. So I'm going to read you an example, and you can tell me if you think it is QI or EBP or research. Nurse Miguel is curious how the pandemic has affected the lived experiences of new graduate nurses who had shortened clinical rotations in school. They would like to explore the perceptions of these nurses as well as their managers regarding their readiness for clinical practice. This is an example of, is that EBP, QI, or research? Research, yes. Okay, next. When administering a sepsis bundle, Nurse Pia has been taught to administer each antibiotic one at a time. Spoiler alert. They have noticed that the lead to medication delays, especially when antibiotics aren't compatible with other infusing medications. They wonder why this is current practice and if there might be a better way. This is an example of EBP, yes. And then finally, Nurse Kaya is on a work group to increase compliance with the practice of skin-to-skin contact for newborn babies and their mothers. They have been doing audits and performing staff education to monitor progress. This is an example of QI. Why do you say QI? What?
The data.
Data, progress, data collection. Yeah, those are all like our buzzwords for QI. Okay. Who here has done an EBP project? Please raise your hand. Like a third of people? Yeah. Has anyone ever used Appendix A, the PETS process guide in EBP? Kathy's raising her hand. Has anyone else ever used it? When did you guys do your EBP projects? Like a couple years ago or longer ago?
8 years.
8 years. Okay. Okay, so this is exciting because this tool that I'm about to talk about didn't actually exist when you did your EBP project. So which is maybe, well, the front page is like a planning table to help you figure out like what month things should happen. But the second page is what's new and what I want to talk about. I'm going to see real quick if I can try one more time to share this. All right, I'm gonna start over from the beginning. I'm just kidding. Oops, well, I will, but not, okay. And you will have access to these slides. So if you want to look through these definitions a little bit more that I sort of breezed through. All right, so back to our beautiful Appendix A that is going to be brand new news to everybody here. So this is on the second page of Appendix A. There's a couple like big things that I always tell people about EBP. And one of the things I really want you to walk away with is that you should always do this. It's going to save you a tremendous amount of time. And what it's called the decision tree to determine whether or not you need to do an EBP project. Please do not spend weeks or months or years sometimes doing an EBP project that does not need to be done. So this is going to walk you through the steps. So we're going to start here on the left where it says start. With our problem statement. So we're going to figure out what's actually causing our issue. We need to, if we start with the wrong problem, we're going to end up with the wrong solution. So please don't breeze by the problem statement step. That's going to lead us to our EBP question, which is usually also what helps us perform our literature search. And then we're going to determine the need for an EBP project. So we're up here in these top 3 boxes. The question that we want to ask ourselves before we actually continue with this algorithm is, does this problem fit organizational priorities? If you really want to change all the water bottles that the nurses get on Nurses Week, do you think that your administration is going to dump a whole bunch of resources into that problem? So that's sort of like an extreme example, but there are a lot of times where our nurses are being inundated with, I mean, how many emails do you get every week telling you about this new initiative, this new thing you have to remember, this new thing you have to do. And at some point, there's going to be some prioritization about what we can't give everyone all the messages all the time. And some things start to be determined to be not quite as important as others. Usually, unfortunately, we focus on regulatory issues. But please make sure that you're actually addressing a problem, that when you find the solution, you're going to have some currency to actually put into place, both currency in terms of money, but also buy-in. So once we've determined if it fits our organizational priorities, this is the magic question. Does a recent, relevant, high quality evidence synthesis exist? That's the magic question. All right, so what does that mean? It needs to be the right topic, correct? So if we want to look at how often we should be changing peripheral IV catheters, I'm likely going to need to look and see if there's evidence about those peripheral IV catheters. That one's a little easy. The next question, right time frame. How recent does something have to be for it to count as recent? 5 years is the answer I'm hearing, saying it for the people on the Zoom. Has anything happened in the last 5 years that has dramatically changed the amount of literature coming out in our journals? Yes. Okay, so maybe not 5. Is there another number? 10. Why 10? 10 because it's before the pandemic. do you think there's one right answer to this question? Okay, people hate it when I say this. There is almost no one right answer for anything in EBP. There is just a consistent answer, and you have to explain how you got where you got. So if I say I want to look at integration of the EHR on nurses' personal cell phones, and I'm going to look at literature starting in 1970 and more recent, does that sound like that would be the right time frame? No, right? Because the EHR didn't exist in 1970, or even if I go back to 2000 or 2005, the way that it's been integrated, I've been a nurse for 10 years, and I even think back like to nursing school 10 years ago, and some of the sites that we went to still were half on paper, half in the electronic medical record. So we were doing a project recently about using nursing report cards to see if we could increase nurse compliance with documentation or throughput. And so we decided to embark on a project like this and started asking ourselves these questions. And the time frame, we found a Cochrane review, and we said, okay, great, this is the right topic. Now the right time frame. So we looked in the Cochrane review. They've actually updated it since. I have to remind myself of the dates, but it was published about in 2017. But because of how time works chronologically, every article that was in it was published from 2015 and older. And so when looking at those articles, almost every single article that was pulled in was a hand audit of the chart. Are we doing a lot of hand audits? No. Hopefully not. And so if we're going to talk about creating a nursing report card, anything that we're going to do moving forward is, I really hope, going to be auto-generated from the EHR. If we think about Tableau even, and how much we've started to use that. So the question about that was, this is probably too old. This no longer applies to our situation. So again, there's no one right answer, but the whole team has to be on the same page about what that time frame is and why. So something that's really changed a lot in the most recent time period, like technology, you're going to need to find something very recent. Something that's been a little bit more static, you could make an argument that you could pull in data from years prior. Again, the pandemic has really changed our landscape in so many ways. And so you'd have to make a pretty compelling argument to pull things in that are, older than 10 years. But there's plenty of things that, like, have we changed the way that we put in IVs that much? I'm actually asking, I don't know. Did we do them a lot different 10 years ago? I won't look at anyone to imply who I think might have been a nurse 10 years ago. All right. So there you can make an argument for things being older. Okay, and then right population. How do I know if it's the right population? Does it have to match? If I'm looking at oncology nurses working with patients who are 65 years and older, do I have to only look for information for oncology nurses working with patients 65 and older? Yes, no, maybe. Maybe. Right? So if it's something that's extremely specific that only applies to a specific population, and any other information I find could not be reasonably extrapolated to my group, then I might have to say, yeah, I can only look at this population. Keeping in mind that there is likely not going to be a ton of information on them, and we might end up not being able to fall into this EBP category. Again, back to that nursing report card example, when we went to the Cochrane review, almost all of the people that had been pulled in, it was healthcare professionals in general. It wasn't just nurses. So that included pharmacists and doctors. It turns out that a very small proportion of the articles included in the review were actually about nurses. And doctors, a lot of times their pay is linked to these metrics. So how many hours are they billing? How good is their documentation? Things like that. And so a doctor getting a report card might be directly linked to compensation, whereas a nurse, my patient falls, my patient doesn't fall, I get paid the same. Hopefully that's not the reason I'm doing my fall assessment. But we were saying that this is not necessarily something that you can apply across all these populations when someone's linked to a compensation and someone isn't. And so we actually decided that we didn't have the right time frame and we didn't have the right population. So again, there is no one right or wrong answer. You just have to all be on the same page, and you have to give me a good reason why you decided what you decided. So if you think about, if someone's going to read your project at the end, and not in like a friendly way, but they might say, oh, hey, I saw that all your information was based in a rural setting and you're in an urban setting. Why did you decide that? And whatever you would say in that moment, that's your reasoning. All right. So where do we go to find these recent, relevant, high quality evidence syntheses? If I had a prize, I would give it to you. Anyone could get either of these. You get recognition. There's a prize apparently. Sinnel's one place you go. There's two places that are really well known for having high quality evidence reviews and synthesis. Cochrane, yes. Okay, everyone gets an apple or an orange. Cochrane is one of them, yes. There is another one. What's the other one? PubMed is going to pull a whole bunch of articles, and it will pull articles from this organization. But what organization? It's kind of considered the nursing equivalent to Cochrane. Sinnel is like sort of the nursing equivalent of PubMed. Sorry, what'd you say?
I thought it was Linda something. I can't remember.
Joanna, maybe? Joanna Briggs Institute. Can you raise your hand if you've heard of Joanna Briggs Institute? Okay, for the people online, there's about half the people. Does anyone want to tell me what it is?
It's all the evidence-based studies about different nursing topics, so you can look and see
That's the perfect answer, exactly. So it's the nursing equivalent to Cochrane. So Cochrane is considered the gold standard in high quality evidence reviews, and Joanna Briggs Institute, they do a lot of different things, but really their concentration is nursing topics to generate actionable evidence summaries and synthesis. So you can actually say, all right, this is how we're going to do it. We're running a little short on time, so I'm just going to show you Joanna Briggs because that's the one that most people aren't as familiar with. Does this page look familiar to anybody? What is this? This is something that you have all access to as Johns Hopkins nurses, which is the Welsh Library. So I want to go to Joanna Briggs Institute, but the most important thing that I have to do before I do any of that is log in. So you see this in the top right-hand corner that says log in. You have to click log in, and I'm logged in under Annie. So it's going to show me Annie's JED in just a second. All right, so now it says hello, Jed, and Annie's Jed up there. So we know we're logged in. Now to actually get to Joanna Briggs, I've been advocating, and now it's like on a recording, so I can continue. I'm like on record for this. I've been really advocating to get Joanna Briggs onto the landing page of Welsh. I have not been successful. Maybe I should start a petition.
Yeah.
Okay, I'll start to think about that. Okay. All right, so so it takes 2 clicks instead of 1. So there's 2 different ways to do it. The way I usually do it, you can also bookmark it once you go there. But if you click on databases and you click up here, biomedical databases by title, Joanna Briggs Institute rebranded as JBI, like, you know how Weight Watchers became like WW. So it's now JBI. And so someone actually pointed out to me recently that you used to be able to type in Joanna and now you have to type in JBI. So just keep that in mind. It pops up. And then you have to click again. And in all honesty, their webpage kind of looks like a beta version of the website to me, but it works really well and all their content is amazing. And you do, as a side note, you do have to be logged in. They have a externally facing website that doesn't have the same amount of access that we have. So let's type in, let's look up those nursing report cards. And the sort of fancy word for nursing report cards is audit and feedback. If you guys didn't know that. The search always also takes a second. Okay, so I have audit and feedback, and I have 748 results, which are up here. So I'm going to scroll down. And the first thing I see is practice and outcome, audit and feedback. Evidence implementation strategy, audit and feedback. And then this one's specifically about audit and feedback in a residential aged care facility. Do keep in mind that sometimes it says protocol, which means it's what they're gonna do. They haven't done it yet. So sometimes I get really excited and then realize I have to wait like 4 more years. So don't get too excited. But if you click on the link, you can actually click on the link, or you can just click on, there's a view PDF. You do have to come over here and click on JBI database PDF. And it's going to bring it up for you. Again, their whole goal is to make things easily digestible. And so this practice sheet is, I want to say, 3 or 4 pages. And so it's going to say, the question is, what is best available evidence regarding audit and feedback to improve a healthcare professional's practice? That was our exact question. This was unfortunately published. You can see the search date was 2021. They also used the European date, so it's flipped. So it's actually February 11th, 2021. Which was, we did our search in it was prior to COVID, so it was a while ago. So this didn't exist, but it's going to give you your clinical bottom line and go through all of the evidence that they included. And then at the very end, it gives you a best practice recommendation. Contextually designed audit and feedback should be used to improve healthcare practice and patient outcomes. So instead of doing an entire EBP, if it was 2021 when I did my project, I could have come to JBI, looked at the articles that they included to make sure they match my population, looked at the dates of those publications to make sure they were most recent enough, or they were recent enough to reasonably apply to my setting, and I could have skipped my whole EBP. I actually wonder, I guess there's a chance that we're cited on here. I don't know if we are actually. That would be cool. No, we're not. Okay. That was extremely quick. We do have, these slides will be available. We have a good, on the slides, there's also a good example of a group that did this for dual sign-off for medications, because obviously with COVID, that's become so much more onerous to have two people gown up, come in the room, especially if you're doing a medication that needs frequent rate changes. And they were able to find a JBI summary just in the time that I talked to the person on the phone for 15 minutes. We pulled it up and we avoided months of EBP project. So the takeaway is you are all very important. Your time is very valuable. Please do not do an EBP that does not need to be done. Thank you. All right, and I will, I'll be around after if you have any questions.